Hip replacement surgery. We see patients who have hip arthritis. Hip arthritis is a condition which causes pain in the groin, but it can cause thigh pain and back pain. When the patients develop severe arthritis, they find it difficult to walk, they limp, it affects the quality of their life, and they can't sleep. This is the stage that we have to consider hip replacement surgery. Hip replacement surgery is where we remove the damaged part of the hip. The hip joint consists of a ball and socket joint. So we have the ball, which has a coating, and that goes into a socket. And when that erodes down, we get bone on bone, which causes the pain. In a hip replacement, there are two aspects. In the first, and we're going to show you this in the model. In the first aspect, we have the socket where we prepare the bone and we impact a shell with a liner. That's part of the construct. And then we have the thigh bone, which we prepare the bone, which is hollow, and we put a stem into the bone, and that forms the second component. Those together will then form the hip replacement, which is a ability to walk without pain from the damaged surfaces. Now, hip replacement surgery is very different to knee replacement surgery. 90% of people are satisfied and the recovery is much quicker. The hip arthritic pain will go after the surgery. There is some surgical pain around the side of the hip or the thigh, and that will continue for a week or two, but the deep arthritic pain is relieved immediately. This is different from a knee replacement, which is painful for 6 weeks. We carry out minimally invasive surgery by minimizing the damage to the muscles, so we allow our patients to walk straight away. They can lie on their side, there's no restrictions that they need to be on their back, and we allow them to drive at 2 weeks instead of 6 weeks. This gives a very enhanced recovery and allows the patients to get back to activities they enjoy earlier. We see a patient in clinic, they'll have hip arthritis, and we'll list them on the booking form and make the appropriate booking. The patients will then be seen in a pre-assessment clinic 2 weeks before surgery. They will have a detailed medical history and checks, they will have blood tests, and they will have swabs carried out. The MRSA is a swab looking for an organism which must be absent before we can proceed with surgery. Once they're clear, they're booked in for surgery. They turn up, they must be fasted for 6 hours before the surgery. When they turn up to the theatre list, the anaesthetist will see them. Most patients, I would say over 95% of patients who have hip replacement surgery will have a spinal. Patients often worry, if I'm going to have a spinal, I don't want to see anything, I don't want to see anything or hear anything. The patients are given sedation, so they're not aware of anything. And this is effective and helpful because it helps control the pain and it reduces the risk of blood clots. Patients will go up to surgery. The operation will take 1 hour, 15 minutes. Patients will then go into recovery for another half an hour. When patients return back to the ward, we monitor their blood pressure, we monitor their pain levels. Most hip replacement patients do well. We're able to get them up, mobilize them within a day or so, and the majority of patients will go home after 1 night. Occasionally they stay for 2 nights. Patients, whether they have a hip or a knee, are at risk of blood clots, and we minimize this by getting them mobilized early, by using stockings, and by using injections, which are blood thinners, for 4 to 6 weeks. We will then allow patients to go home. We will see them at 2 weeks and check the wound. We don't use staples, we use a cosmetic suture, so nothing is removed. We then see them at 6 weeks, and most people are doing very well at 6 weeks and can be discharged. We provide a telephone backup at 3 months to see them finally, and then all patients in our pathway are given the ability to come back at any time by contacting the office. Thank you.